Are you over 70 and trying to stay on top of your health? What if I told you that some routine checkups, the very ones your doctor recommends every year, could actually do more harm than good? That's right. Some of the most common medical tests for older adults are now being questioned by science. Not because they're ineffective in general, but because in people over 70, they may lead to unnecessary treatments, risky surgeries, and lifelong complications. In this video, we're going to uncover 5 common health checkups you may want to avoid after 70, based on the latest research. You'll learn how to protect yourself from fear-based medicine and make smarter, safer decisions for your health. Don't forget to comment below, tell us your age, where you're watching from, and if you've ever regretted a medical test or procedure. We read every comment and reply with personalized tips. Let's get started. Coming in at number 5, bone density scan, also called a DEXA scan. This test sounds harmless. A quick scan, no pain, no needles. But here's what no one tells you. After age 70, this test can cause more fear than benefit. Bone loss is a normal part of aging, just like gray hair or wrinkles. So it's no surprise that most seniors who take this scan are told they have low bone density. But instead of reassurance, they're often put on medications like bisphosphonates, drugs that can cause serious side effects like jawbone death, osteonecrosis, stomach irritation, and even increased fracture risk. In fact, a major study followed over 1,200 women aged 70 and above and found that these drugs reduced fracture risk by just 0.3% over 5 years. That's barely a benefit, and not worth the risk for many. Let me tell you about Rose, a healthy 76-year-old who walked every day and never had a fall. Her doctor sent her for a DEXA scan, and the results showed mild osteopenia. She was prescribed medication. Within weeks, she developed severe reflux and jaw pain and couldn't even play piano anymore. She came off the drugs and started doing weight-bearing exercises, ate more calcium-rich foods like sardines and greens, and added vitamin D. A year later, her bone strength improved naturally and her life was back on track. What's the alternative? If you're not falling or breaking bones, focus on lifestyle, resistance exercises, proper diet, and checking your vitamin D. A 2022 study in Osteoporosis International showed these simple steps reduce fractures by over 20%. So remember, a DEXA scan may sound smart, but after 70, the better choice is movement, not medication. At number 4, the PSA test for prostate cancer. If you're a man over 70, your doctor may still recommend this test. But here's the shocking truth. The U.S. Preventive Services Task Force advises against routine PSA screening in men over 70, and for good reason. Why? Because prostate cancer in older men often grows so slowly, it never causes symptoms or death. But once the PSA test shows an elevated number, fear kicks in. That's when the real problems begin. Biopsies, surgery, radiation, treatments that can lead to incontinence, erectile dysfunction, and infections. The truth? Many of these cancers would never have harmed you. But now your life may never be the same. Let's take the story of James, 74, who lived an active life and volunteered at his local park. A routine PSA showed a number slightly elevated. That led to a biopsy, which led to surgery, which led to permanent urinary issues. The cancer? So slow growing that his doctors now admit it likely wouldn't have caused trouble for 10 to 15 years, if ever. According to a New England Journal of Medicine study, for every 1 man who avoids death from prostate cancer thanks to PSA screening, 47 are harmed by overdiagnosis or overtreatment. Instead, after 70, many experts now recommend watchful waiting or active surveillance, especially if you're feeling well and have no symptoms. Here's what to ask your doctor. Is this test truly necessary for someone my age? What happens if we just monitor it instead of acting right away? Being informed is powerful. After 70, the best approach might not be aggressive testing, but wise observation. Let's talk about number 5, the colonoscopy. Colonoscopy is an important test in your 50s and 60s. It can save lives. But after age 75, the benefits start to shrink and the risks begin to grow. According to the American Cancer Society, routine colonoscopies are not recommended after 75 unless there's a specific reason. Yet many older adults still undergo this invasive procedure without fully understanding the danger. Here's what you need to know. The prep for a colonoscopy is difficult for many seniors. It involves powerful laxatives that can dehydrate the body, upset medications, and even trigger confusion or dizziness. Then there's the test itself. Anesthesia can cause lingering side effects in older adults, including delirium, memory fog, and falls in the days that follow. The worst part? In people over 75, the chance of finding a dangerous cancer is often lower than the chance of complications from the test itself, including bleeding or bowel perforation. Let's take Helen's story. At 78, she had a routine colonoscopy. No cancer was found, but she developed an infection from the procedure that kept her in the hospital for 6 days. Her son later said, "If we'd known the risks, we would have chosen differently." So what's the smarter path? Doctors now recommend less invasive screening methods after 75, like stool-based tests, FIT test, every year or two, CT colonography, a virtual colonoscopy, or skipping screening altogether if you're healthy and symptom-free. Ask yourself and your doctor, how likely am I to benefit from this test? And what's the real risk to my body and brain? Sometimes, the wisest decision is to say no and spend your time doing what truly matters. Now that we've covered the 5 tests to question after 70, let's shift gears. Because here's the truth. Just because you say no to a test doesn't mean you say no to your health. In fact, it's quite the opposite. You're saying yes to a smarter, more personalized approach. One that honors your body's wisdom, your lived experience, and your real needs at this stage of life. So, what should you focus on instead? 1. Frailty and fall risk assessment. This is often overlooked, but it's a powerful predictor of long-term health. Ask your doctor for a gait and balance evaluation, a grip strength test, or a timed up and go test. These simple measures tell you more about your health span than many blood panels ever could. Why? Because mobility is longevity. If you can walk steadily, stand up easily, and recover from stumbles, your chances of thriving in your 70s and beyond skyrocket. 2. Medication review. After 70, most adults take multiple prescriptions, but some combinations can be harmful. Ask your pharmacist or doctor for a comprehensive medication review. Focus on drugs that increase fall risk, like sedatives, duplicates from multiple providers, pills you may no longer need. Cutting back, safely and with guidance, can boost your mental clarity, balance, and even independence. 3. Nutrition and muscle check. You don't need a full body scan to know if your body's changing. Instead, track your muscle mass and energy. Are you losing strength? Feeling more tired after meals? Ask about protein intake, vitamin D levels, and simple strength-building routines that fit your lifestyle. Even 10 minutes of daily resistance work can slow age-related muscle loss and protect against falls, fractures, and fatigue. Let's wrap up with something deeper than lab tests and doctor visits. Because after 70, health isn't just about numbers. It's about confidence, clarity, and peace of mind. And the truth is, you don't need to chase every scan or blood test to be safe. You need to tune into your body, trust your instincts, and work with care teams who see the whole of you, not just your age. So here's what I want you to remember. You can ask questions. Just because a test is offered doesn't mean it's required. You can say not now to certain procedures and still say yes to your health. You can build your own health plan, one rooted in movement, nourishment, connection, and joy. Think about this. A long life isn't just about adding years. It's about adding life to those years. And sometimes the most powerful step isn't another test. It's deciding how you want to live this chapter. So, whether you're walking daily, gardening, laughing with grandkids, or learning something new, that's health. You are not defined by your chart. You are not limited by your age. You are alive, capable, and wiser than ever. Take that wisdom with you to your next doctor's visit. Ask the questions. Trust your gut. And remember, you are your best advocate. And we're right here with you, every step of the way. Thank you for watching. If this helped you think differently about health after 70, give us a like and share this with someone who needs it. And don't forget to subscribe to The Golden Path, where your journey to strength, clarity, and joyful aging continues. Until next time, stay strong, stay curious, and stay golden.